All right. So good morning. Good morning. Nice to see you guys and faces and all that good stuff. I'm Haida Hill with 19 Services, and we've got Ann Weinstead here with us as well to chat through our conversation today with Network 19. Christy Black's also joined us in person. So we got two Christys, but I'm Haida. Christy's over there. So yeah, we're gonna talk about some HR compliance and all that good stuff. And as usual with Network 19, we welcome conversation, we welcome questions. We want to be here as a support to you all. So please, please, if you have a question, a thought, something you want to hop in on, we would love that to happen. So I'm going to go ahead and share my screen here. All right, so we should be, let's see, yep, we're here. So I'm gonna try to put us into presenter mode. Sometimes it kind of goes wonky with me with my Zoom, so I'm gonna try here. All right. All right, so again, thanks for joining us for the month of March. Kind of crazy where we're at weather-wise, and who knows what's going to happen. Hopefully, we're going to get some warmer weather again. So, again, Network 19 is a community of, everyone, providers, agency providers to be able to share and chat about things that are going on and just be able to provide some help and resources for you all. I'll say this here. I'll probably forget to say it again, but this is recording. We will send out the slides afterward, along with any additional resources that we're sharing. And yeah, I have at the end our Facebook page if you haven't joined that yet. So I'll go ahead and get going here. And please feel free to hop in wherever feels great to you.
Well,
All right,
thank
so I
you,
kind of
Heidi.
wanted to start off with like a visual here. If you guys have worked with us for a little while, we help a lot regarding HR or personnel compliance. And kind of one of our themes is if we struggle with HR compliance, typically your compliance review will struggle. A lot of citations that we see, if there's going to be a bulk of citations, tend to be in the HR section, the section 7 of the compliance tool. And so we have some of that here at the end of our slideshow, just kind of pointing out some of the top citations. But I kind of think of HR or personnel citations as a domino effect. So sometimes one issue, such as a data hire or an off registry check or something like that, it kind of causes a domino. And so maybe one issue could turn into potentially two or more citations. So anyway, I started off with a visual here about, HR compliance is like building a house on a foundation. So we want to start with building on the firm foundation. What we see is when we have providers that have a very firm HR process, and especially an onboarding process, we tend to see that go quite a bit smoother, and we tend to land on firm foundation almost every time with a new hire.
And I think,
All right.
Heidi, I was
Yep,
just
go,
going to
please.
mention,
Yep.
I think that it's not only starting on that firm foundation, but it's that everyday maintenance. So any of us that are homeowners, right, we know that we have to keep an eye on that foundation, make sure there's no cracks, make sure that we're not seeing any settling, which happens as we kind of get set in to, a home we've been into for a long time or routines we've been into
Mhm.
for a long time. So not only starting off by building on the firm foundation, but also making sure that you have systems in place to maintain that foundation and to do self-reviews and internal, self-review to make sure that that foundation is staying firm and staying steady.
Absolutely, absolutely. I think we all know, right? Like we can kind of get settled into doing this, and maybe we've got one mishap here, and then another one happens. And as we always say, yeah, and we'll be talking more about internal compliance here soon, but what does that internal compliance process look like to be able to say, hey, we've got an oops, we fixed it, we're going to do the best we can, and we're going to make sure moving forward we're rectifying it. So absolutely. All right, so I figured we would kind of start off with what rules apply to HR or to personnel. And honestly, in reality, I even have a little thing down here. This is not an inclusive list. Almost every one of our service rules and different, they have some component related to staff and the provision of services. So I want to be super duper clear on that one. But as far as like the items that we pulled out here, these would be our main overarching rules. And I tried not to go too deep into all of them because we could be here a long, long time to talk about all the different things. So first off, I wanted to point out the background investigations for employment rules. So the 5123 2-02. And I gave like little clips of what's the overarching piece to this rule. So if I go look at this rule, what is it trying to tell me? So the background check rule is holds all the information regarding BCI and FBIs as needed. It holds the wrap back requirements, the 7 required database checks, as well as the conditional employment allowances. And I do want to mention here, and Anne, please feel free to kind of, provide any other information here. This rule was just updated back in February, and there was a tad bit more expansion on the conditional employment conversation. Kind of my sense when I juggled through it, a lot of it is what we are already doing or the process of what was kind of in a sense already required for conditional employment. However, I would say it's clarification. That's kind of how I took it. And we have some more slides here regarding conditional employment, so we'll talk about it more. But Anne, I don't know if you have any other thoughts on like, what that means.
So I'm going to be honest. I retired in December, so I have been kind of stepped away for a couple of months. So I haven't done a lot of in-depth review of the changes to the rule. But I think you're right, Haida. I think really, I know that as I was leaving, there was conversations about updates to that rule, and it really was about just kind of firming up those expectations,
Mhm.
putting some things that had been best practices, especially through our compliance teams at the department and folks that were, out there having those conversations about how can you do it, in a way that is best practice and bringing about the outcomes wanted. That some of those were kind of unwritten rules, and
Mhm.
so I think it helped to shore up that like that is the expectation. So.
Yeah, I totally agree. So then let's keep moving along. So we've got provider certification rule, which is has been quite a hot topic over the last several years. Honestly, COVID brought some new allowances in the provider certification rule. So this is what's housing the age requirements and the ability to have a DSP assistant. The DOO requirements are in here. The training requirements are in here as appendices. So again, we'll kind of talk about some of that in a minute. And I just wanted to point out a few other items. We don't dive too much into these today, but I did want to point out the 5123-301. If your agency is overseeing a licensed residential facilities or a licensed homes, Licensed homes do have a sidestep rule regarding administrators and DSPs of the licensed homes. There's a few additional training requirements for both the administrator and DSPs. We have the 5123-603 rule, which is our med admin rule and specific for DD personnel regarding med admin and the requirements regarding who can provide that. And then I just kind of made a side note here of the 5123-9, meaning the whole library of those service policy or service rules. And again, dependent on the services your agency is providing, that service policy or service rule might have specific requirements for staff and training. Just kind of seeing some folks that are on here for our day services and our voc and employment services, now medical transportation. All of you guys have some additional side steps that are required for those services. We could keep talking because lots and lots of services have additional items. And I'm going to let you chat if you got anything. I'm going to move on to the next slide.
Yeah, just really quick, it does look like the provider certification rule. So that 5123-230 or 2108, is it, I believe?
Yes, yes,
So
the '08, yeah.
yeah, so the '08 rule, it does look like there's some movement towards that and conversation towards the update of that rule. So we at 19 Services are going to be trying to pull together some feedback for the department in regards to that rule. So I'm going to put my email address in the chat. And if there's anybody that wants to share any suggestions or ideas or thoughts around that current rule, we're going to hopefully get that pulled together here in the next week or so, and get that sent to the department who is asking for some feedback on that.
Awesome. Thank you. Yeah, and we'll talk about that rule here in a couple of slides to just kind of maybe get you guys' minds thinking about that. All right, so the 5123-202 rule is our background check rule. So I just went ahead, we kind of pulled out some specific points here. So, the rule is specific to the standards for conducting background investigations of individuals who are employed or seeking employment in the DD system. The rule ensures that individuals working in positions where they may supervise or be alone with individuals have been properly screened for criminal history or other disqualifying factors. So, kind of boiling it down, this rule protects the health and safety of individuals receiving services. It ensures that we're screening the employees prior to them beginning work and identifying criminal offenses that may prohibit someone from working in the DD system, and establish procedures for conducting, reviewing, and maintaining background checks. One thing that I think is just kind of a side note here, I'm going to move on to this screen too, is that when we look at the background check rule, and we didn't pull out all of this extra language, we have plenty of resources we'd be happy to share with folks. But just kind of as the quick reminder, we've got to have a BCI ran, and we typically run it under the 5123-081 code. There are additional codes that can be ran, especially if your agency is providing counsel on aging services or some of the other services. There are additional codes available, but we want to make sure that we're running it under the correct code, because that code allows for that background check to fully open up the staff member's criminal history. And one point that we always like to make here, we have staff, plenty of folks that have maybe tried to get their criminal history expunged, or maybe they've had sealed transcripts. We just like to clarify that those items are kind of washed away even with this code. We have to review expunged and sealed transcripts, even though they may have gone through that process. Those codes pull them forward, and they are applicable for potential disqualifications if they are within that time frame. The other thing I would point out here with this rule, it sometimes gets kind of jungled up, if you will, or jumbled up. is the way in which multiple disqualifying offenses affect a staff member's eligibility. And we could spend lots and lots of time on that. We're more than happy to have side conversations on that. Again, we do have a resource directly from the department that we pass out, and it's regarding, let's say a staff member has two of the 5-year disqualifying offenses. A lot of times we see that regarding theft or maybe passing bad checks or a few of similar types of offenses that maybe happen in a really short period of time. And so when those two items overlap, we have to look at those two together. And there's actually, I guess I would say, mathematics regarding how long that actual offense disqualifying time frame is, and it extends. And so the BCI rule itself tells you that mathematics, but we have a shortened version of that. We're more than happy. We'll send that out with this slideshow because it's actually a resource we got from the department. So the other piece to the BCI rule is the FBI requirement. So FBIs are required for staff members that have lived outside the state of Ohio for the past 5 years. The other thing we like to remind folks of is your BCI is the item that's getting enrolled in WRAP-BAC. The FBI is not. And so we get a lot of questions about, well, do we need to do the FBI again? And I think the question we have to ask ourselves is, well, where does that staff member currently reside? So if it's a 5-year check, right, for all of us that have been around before WRAP-BAC, we were doing these consistently every 5 years, BCI or FBI. But now that we have WRAP-BAC handling our BCI component, the question about FBI is, again, we have to ask ourselves, where's that person residing now? So maybe when they first started working, they had just moved from Oklahoma and now they're in Ohio. So we're going to run the BCI and the FBI. But now 5 years later, they've been in the state of Ohio now for 6 or 7 years. And so that answers your question. We wouldn't necessarily be doing an FBI. However, for those of you all that provide services, especially on the outer skirts of the state of Ohio, so like Cincinnati, we've got lots of Kentucky staff, or even down in the Scioto area, you might have staff that reside permanently in Kentucky. For those of you that are up north, you might actually have Michigan staff or Indiana staff, right? Even Pennsylvania staff on the other side. So we have to take that into consideration. It doesn't null and void the BCI. We still have to do the BCI, do the WRAP-BAC, but the FBI would need to continue to be ran every 5 years in order to stay in compliance. So I like to talk through that one a little bit because it can get a little bit hairy. Again, the BCI rule is where all of these components land. So I'm not going to talk through each one of these points here because I kind of just did in a sense. But Anne, do you have any thoughts on those things?
So I think the most important thing to remember is what Haida has highlighted there in the first bullet point, which is direct contact. So again, making sure that as an agency, you have a solid policy on what that means. There is a definition and rule, but I know that sometimes for each agency, it looks a little bit different. So a lot of times what a reviewer is going to do is they're going to ask your HR person, like, how do you determine who you conduct the background checks on, and what does direct contact mean? So, one of the parts of the direct contact definition in rule is about being alone with a person. So just having a really good agency definition and policy on what that means for your agency. Because, for instance, a maintenance person in one agency, maybe it's a larger agency, and that person absolutely is 100% maintenance. They only get called in when, the air conditioner breaks down or whatever. So it's very, very clear that that person's job duties don't meet that definition of direct contact. But we have smaller agencies where everybody is hands on deck. So the person that does your maintenance may also be sometimes providing some type of direct service to the person, a billable service. They're alone with that person. supervising them based on what's required in the rule. So just making sure that as an agency, you have a clear definition for your own agency of each employee and how they meet that direct contact definition that's in rule. I think that's a place where a lot of agencies in the past, in my experience, have gotten hung up. And as Haida said at the very beginning of this, HR personnel is the biggest section of the tool, and one record that is just not quite right can lead to numerous citations. And so having those policies and procedures, kind of looking at those requirements under personnel and just making sure that what you have in place for your system is consistent with what they're looking for.
Absolutely.
Hey,
All right.
so I have a question. Can
Yep.
I,
I was going to say, I'm going to pause for a question. Go ahead, please.
yes. So say if you're at a house with, let's just say, three staff, is that considered direct contact if it's three staff there? And so say like if you're waiting on a background check, is that considered direct contact if it's two other staff that's there with the person while you're waiting on a background? Because I know you said that direct contact when you're alone. So is that considered direct contact when you're alone if you have three or four staff in the house?
Yeah.
It's
We're
about the job duties.
Yeah, yeah, yeah. Let's kind of talk about this next slide because
Okay.
Rolando, I think it'll help answer part of where you're at because this is where it starts talking about conditional employment.
Okay.
The whole that concept of, hey, we've hired a staff person, we've gone through this process. We sent the staff person to get their BCI. We call it receipt for BCI.
Okay.
That's what you have to hold on to. And we talk about it a tad bit more here. You have a 60-day time frame to receive that BCI. So the piece that under the conditional employment is that, and it's this what almost second to last bullet point here, is that we've initiated the BCI, whether you've sent them to get it, you have a company that maybe you send them to, or if your agency has your own BCI machine, you're able to say, yes, in fact, they went to get their BCI, FBI if needed. And then you have that receipt of BCI. So we always recommend that we literally have a document that shows the receipt for BCI. So I've seen them all over different kinds of things, and you probably have too, like an actual receipt from a place, that shows how much they were charged, and the staff person sends you a snapshot of that. It could be an actual document. We have some places down in Cincinnati that they actually give the staff person, an actual receipt that says what code was ran and
Correct.
their name on it. You want to have that document because that's what's going to be your proof or your receipt of BCI for that 60-day time frame.
So
Okay.
when you're
Correct.
when you're partnering that receipt with that person's signed and completed attestation statement, then you've done your due diligence as an agency. You have begun the process of initiating the background check because it is required based on the job description of the person. And you've had that person attest and sign an attestation statement saying, I am attesting that I don't have any of these disqualifying offenses. So while you're waiting for that actual background check to kind of validate their attestation, you have done your due diligence. So as long as you can show those two documents, you should be okay with a reviewer. If that person's job description is consistent with direct contact.
Yeah.
Okay.
So for everyone's sake here, that conditional employment are these different check marks. So here it's kind of like, here's the thing, and I have another slide that breaks it. I'm a visual person, so I like to see things differently. Of what do we need to have before we have direct contact with an individual? And I think that's honestly where a lot of hangups happen. And so, and again, Rolanda, this and everyone, this is, if the staff person's with an individual with direct contact, even if they're with another staff member, the rule still applies that we have to meet the conditional employment. So that we have a completed employment application, We've obtained the names and addresses of the applicants or former employers. And that can be, sometimes that's held within the application, right? Like they write on there who their employers were. Attempted to obtain references from those employers. Checked required databases, so those 7 required databases.
Correct.
And initiated the BCI or FBI as applicable. And again, we call it the receipt of BCI, and completed the attestation and agreement. I do want to say with the attestation and agreement, as of today, we are looking to make sure that our attestation and agreement is dated from 2019, when the in lieu of conviction language was added to the attestation. If you need help with that, we are more than happy to send that updated form. I kind of am anticipating that document to get updated based on the most recent rule change, but as of today, we are still using the 2019 language with the in lieu of conviction. So if you've got that document in your office or around, just make sure they're always with a date on them, and you need to make sure that it says 2019. So here's again kind of another visual of like what are those prior to hire items. So we've got our request of BCI. This is just another way of kind of looking at the same thing. You know, we're reviewing rap sheets. When those BCIs come back, we're reviewing any rap sheets, looking at any disqualifying offenses. We're making sure that they're getting enrolled in rap back. We have our 7 registry checks. Again, you might be utilizing the ARC system, which is the automated registry check system. There's some different nuances that come with ARC system. We're more than happy to dive into those questions if you guys have them. But ARCs will automatically check your 7 required. There's an 8th check that is optional, which is the National Sex Offender Registry. We always recommend if you're in there doing the checks, you know, to go ahead and run that 8th check. With the SAMS check, ever since the glitch, I will call it, in the website a few years ago, SAMS check is now a manual check. So when you're in ARCS, you actually have to tell it that you have checked it. It actually won't let you check that it's okay or not until you click on the SAMS link and go run that check. Then you go back into ARCS and say that they were not, you know, there. You do need to print that SAMS check to go along with your ARCS packet. Honestly, the same thing with the National Sex Offender. It's a check that you go do. You want to print that off. So again, happy to talk or answer more questions on those things. Those of you that are in ARCS are probably aware of those little nuances that happen. We could have probably a whole conversation on how ARCS works and the upkeep that goes along with that. But we're very grateful for that system. Yep, go ahead.
There's just a couple of questions in chat. And I know our next slide kind of moves us into a different topic. So the first question is from Tamika. And Tamika wants to know if the every 5-year background checks are still required if employees are enrolled in RAPBAC.
The answer to that is no. As long as they're in RAPBAC, again, the BCI, so the only time this is different is when it's FBI. But for the BCI component, the answer is no. As long as they're in RAPBAC, then they are enrolled until you disenroll them.
And the second question is from Crystal. Can we use code 3701.881 for DODD and ODA? So that code is the Home Health Agency code.
Let me get my handy dandy resource, but I feel like that answer is yes, because that one sounds familiar to me. Anyway, and it was
3701.881. So it's the Home Health Agency code.
Yeah, 3701.881 is acceptable. Yeah. We tend to see that one quite a bit, especially for providers that are doing both services.
So thanks for putting your questions. If you have more, I'm watching chat, so we'll
Thank
try
you.
to catch them as they come in. So thank you.
Yes, thank you guys. All right, I'm going to go ahead and keep moving, just be mindful of our time here. So just one of the other tips we've got on here is about establishing the data hire. This again seems to be kind of one of those things that can get us tripped up some. So understanding the date of hire, this is taken directly from the rule and the tool about what the data hire means in the department's eyes. So from an employer perspective, we might have different thoughts around what the date of hire is. And so we want to make sure that we understand how the department's looking at it so that when we provide a date of hire, especially during our compliance reviews, we're all kind of thinking about this from the same lens. So the date of hire is prior to employment means on or before the date the employee is in paid status. And so it's real important again to think about, okay, is this the staff person has come in, they've done their interview, we've ran our checks. Okay, we're all, we've had them go get their BCI, they've done their attestation and agreement. Okay, staff member Haida, your first day, you're going to come in and do some orientation and training with us is on Monday the 23rd. And if, assuming that they're moving into paid status at that point, that would be their date of hire, not the things that you've done previously, like having them for an interview and checking their database stuff, right? It would be the day that they're coming in based on their first day of pay. The date of hire outlines the required pre-employment items and defines when the conditional employment may begin. So it's really important to think through this because when we're in a review, that date of hire it's like your line in the sand, if you will. So when the reviewer is looking at that date of hire, that's where they're establishing when was conditional employment and when was the first day that they were on paid status.
I always recommended when I was doing surveys to make sure that your HR folks within the personnel files are identifying if you are using date of hire in a different way within your HR system, identifying, whatever you call that, and first day of paid employment so that date of hire definition, first day of paid employment that DODD uses, it might be different than some other date of hire that you guys are using. So just making sure that your HR file includes both of those dates if you are defining those dates differently.
Mm-hmm. All right, the next item I've got, oh, sorry, are we good?
No, we're good.
Okay.
No questions.
The next item we've got up here is this is actually a standalone document. We have it set to send out for you guys with today's resources. This is a list of if you're doing manual checks. So I will say this, we have, we know of some providers that do the 7 registry checks manually, if you will. And then once the staff person is moving into being hired, they will then put them into ARCs. So again, more than happy to talk through all the different nuances there. But if you are performing the 7 registry checks, individually, these are the most current links. This is something that we keep up on ourselves as we help run registry checks for providers. So we keep up on this list, and these are the most active web addresses for those registries. We also have some additional ones at the bottom with the driver's abstract, how to look up a first aid CPR under the Red Cross, and as well as the web link for checking med certification. All right, we're going to move on to the provider certification rule, which it's what establishes our director of operations, the requirements for the DOO. And one, it's the requirements of the DOO. Let's say if you're, because it's also establishing what's required to become a provider agency. So that's kind of the initial push. And then the additional push is what's required thereafter. So you've got your DOO requirements. We have our requirements regarding direct support professionals. I did want to make sure we kind of point this out. This was the direct support assistant role was added in the 2024 provider cert update, and it's kind of been tethering itself out over the last, honestly, couple of years because the direct support assistant was officially named that in the 2024 rule update, but this came about during the 2020, the COVID situation. We were in such a staffing crisis that there are many provisions made regarding provider certification rule training requirements, who could be hired. So the DSP is defined as a staff member that's 18 years or older who provides direct services to individuals. And then the direct support assistant is defined as a youth between the ages of 16 and 17. So no younger than 16. It has to be 16 or 17 years old who may perform limited duties while supervised by a DSP. And we've got that slide here in a minute to kind of talk through that specific role. One thing under the DSP and part of the COVID allowances that moved into the 2024 rule is that the DSP does not have to have a high school diploma. To be a DSP, you do not have to have a high school diploma or a GED. The big however to this, and we've got it in a slide just to keep it in the front of our mind, is when we do that, when we hire a staff member without a high school diploma or a GED, they can never be put into med certification class. They cannot pass medications because that's why I wanted to call out the med certification rule, because that rule is what defines that we have to have a diploma. And so when we're in, and we've got plenty of providers at this point that are hiring folks without a high school diploma, GED. This was always kind of a sticking point for honestly several years up until this change. We just have to make sure, and I've got it somewhere else in here, that we have a system in place to know this staff member does not have a high school diploma. And so, typically we see that through, some kind of tracking system, something you have in place to make sure everyone is on the same page. What we see is, especially with agencies, maybe you have an HR person, representative, that if that person leaves and you have a new HR person coming in, does everybody have that same awareness of what certifications people have and don't have? So anyway, I'll get off that topic because we'll talk about it here in a minute. But I just wanted to kind of pull out those specifications. Anne, did you have some stuff here?
No, I don't think I have anything here. There is a question in chat. It's a hypothetical, and it's going back to the date of hire question. So it says, there's an applicant, we complete the 7 checks on 3/1, we complete the BCI and submit it on 3/6, and they start training on 3/12. Must the hire date be 3/12 or can it be 3/6? And so it can be whichever one you as an agency decide it's going to be. The department is going to require it to be no later than 3/12, because 3/12 is that date that they are starting training and you are paying them to be there for training. If you decide you want it to be 3/6 because that's the date you completed all the pre-hire stuff, you can certainly do that. But just again, keep in mind then when the reviewer looks at what is the date of hire, they're going to have an expectation that any compliance necessary for that new staff person starts on whatever date you selected that to be. So if you select it to be before the first day that you start paying them, there's nothing that says you can't do that. It just means you have to be prepared that you have everything ready with that as the actual date of hire.
Mm-hmm.
I hope that was clear.
Yes. Yeah. Going to go ahead and move on to our next slide. We're going to talk about the DOO or CEO responsibilities. Just to kind of have that clarification here, and again, something for you guys to have in your hands. For anyone that is the DOO or CEO and if you have someone at your agency that is a designee. So the designee, when we're kind of talking about designee, we're talking about official designee that has been uploaded into the PNM system. So sometimes we kind of talk about, oh, well, that's my right-hand man or gal. And when we're talking about designee, that's an actual title within the CERT rule, and it's an actual item within the PNM system under your certification. So if we're talking about having a designee, at least from our perspective, we're saying that they've met all the same requirements as the DOO has. So they're able to take over the business as needed or fill in. So, all right. So the DOO CEO must complete annually. So by the way, and I'll add this to my slide before we send it out, this applies to the designee too. They have to continue doing the same things in that role as the designee. So you need to complete the My Learning annual DOO training. We get questions a lot on this one, like, well, could we take our training somewhere else, or does some other system provide that training? The answer to this specific item is you have to go into My Learning and take this component. Then, and you have at least 4 hours of training annually in topics related to the role. And we pulled out some of those items: personnel management, supervision of staff. The 4 hours of annual training can come from another source. You can take it in My Learning. There's plenty of topics in there, plenty of hours. But if you are utilizing like a brick host system, that might have training available in there, or if you're going to in-person seminars or conferences, or maybe you're taking a specific course on personnel management or supervision, any of you can use, as long as you have training certificates that show, date and time, topic type of stuff, then you would be able to use that for those 4 additional hours. And then the one reminder that we have here is that the DOO, part of the requirement within provider certification is that the DOO is directly and actively involved in the day-to-day operations of the agency. And so when you're having a review, or when you go for a review, that is going to be something that gets tethered out. They're going to ask questions. If the CEO is not actively involved in that review, they're going to have some questions about. They want to make sure that there is direct and activity oversight. It does, there's other pieces to this, but Anne, I don't know if you had any other thoughts on that part of it.
Yeah, and I think Tamika must have seen our slides, because 2 slides ago she asked this exact question. So Tamika, you were right in our head. And I just copy and pasted directly from the agency review tool the guidance on the question about the DOO's day-to-day operations. And so what they say in their tool for their reviewers is that the reviewer should verify through interview the frequency of the administrator's presence in the facility. So that is if it's a licensed facility setting, and then also verify through interview and documentation the process by which the administrator is overseeing provision of services. So though that one is talking specific about in a licensed facility, it is the same thing in community-based settings. So what the reviewers are doing, and the way that we trained reviewers when I was a compliance manager, was, you're going to be talking to sometimes guardians, you're going to be talking to direct support professionals, you're going to be talking to the people that are in the sample who are receiving services. And do they know the name of the director of operations? Do they know how to contact the director of operations if they have a concern or a question? How many times has the DSP engaged with that director of operations? When was the last time they were in the home? So those are the kind of questions, whether it's a licensed setting or whether it's a community-based setting, that the reviewers have been trained to ask. And I will say, just a little insider kind of clue. We also tell them if they run into a situation where they're hearing that people don't know who that is, or they've never been to the house or whatever. That is a question that we then take to the management, the reviewers are to take to the management level, and have some conversation about what that means. So it is something that they take seriously. It is something that doesn't always end up in a citation. And I'll just give you kind of an idea. There are some very, very large agencies where a director of operations is maybe headquartered in a different part of the state. Sometimes directors of operations are headquartered out of the state. That agency, though, has put in a process by which people receiving services, direct support professionals, guardians, etc., know how to contact them. They make themselves available. They maybe are having virtual staff meetings with the folks in the home. So they are or have always been, in my experience, open to alternative things. But again, if I talk to that director of operations and I say there's an issue at, Haida's home with her direct support staff, I would expect, and the reviewers would expect that that director of operations knows about that situation, that they're actively engaged in finding a solution. So those are the kind of things that the reviewers are typically looking for when they're asking that question.
Mm-hmm. Yeah. Great points. All right, so we're going to move into talking about some of the requirements for the DSPs, as well as some of the training pieces here. So agency providers are responsible for ensuring staff meet the age and qualification requirements, that the background investigations are done, that required training before providing services has been completed. They're supervised appropriately by the agency. And that's kind of just an overarching global statement from the rule. Staff must also demonstrate the ability to communicate effectively, follow service plans or OISPs, and maintain documentation and compliance with provider rules. Again, those are all kind of just some overarching pieces that come out of the rule. We get asked a lot of times about the training requirements specifically for DSPs, and we can add in some of those other services that we talked about, right? This is a visual we put together not too long after the provider cert rule was updated regarding the training requirements, because the training requirements are all now appendices of the provider cert rule. It used to be integrated in, then they pulled it apart because it's just a lot. It's a lot of detail because you have to define the DOO training requirements, you have to define the DSP training requirements, and then there's a appendice regarding other. And so there are some providers that are exempted from certain pieces of the training requirements based on the services they provide. So that's a lot. That's a lot of content to put into a rule. And so the appendices kind of help guide us with the specific role. And so we pulled that out and did this. And I'm one of, again, you guys can tell I like to have my visual aids. Like, tell me this in another way that I could understand it. So this is a very simplified. Please know it's not all inclusive, because it would be all inclusive based on the services that you're providing as well as what the DSP is doing. So we've got our onboarding component, which is the top set of boxes, and then you have your annual training component. And so I would try to break it down into simplified terms. So we have our DODD required 7 modules, which is approximately 3.5 hours. These are the sources in which you can obtain that training. So My Learning, first and foremost, from the department's website. Britco has this training directly embedded in their system. And then it also can be done by an agency provider with the DODD materials. And we like to really emphasize that because that is a requirement. So if you've decided, we have a few providers that do this. You guys do in-person orientation, and you want to be able to just incorporate this into the 1 or 2 days worth of training. completely fine. You have to use the department's materials. And I will say that the materials are to be done in person with a spoken voice. The materials, if you hand somebody that PowerPoint, there's not enough information in it to really gauge it. You also have videos that are embedded in there. So we do like to kind of point that part out, that if we're doing this, and we have been part of reviews where the department has asked the provider to see their training material. They want to make sure that the training material is the correct materials. So those are kind of the nuances with the required 7 modules. You've got your agency specific. So these are the things that we're going to learn about agency ABC and what's our mission, vision, values, our work rules, policies. The 30-day training requirement is in here regarding community integration, person-centered planning, and I know I'm missing one other one. There's 3 items. But again, there's more, right? So if you're a day service or voc provider, there's other things that need to be happening. I don't have on here the manager training because I made this specific to DSPs, but there is the manager training that would be required within the 90 days of them becoming a supervisor. All right, we've got individual specific. So we have the ISP, OISP specific training, what we need to know about Johnny and Susie. We have training that might take place regarding the home, like here's what we need to know about the house that we're working in or the day program that we're working in. And then if they're med certified, they would have their med admin specific. So you have medication administration certification, but then you have your IST that's specific to the person. What medications are they on? What are they allergic to? How do they take their medication? So on and so forth. Then the other items, so first aid CPR is required. It's within waiver settings, home and community-based settings. First aid CPR is required before direct contact. There are provisions in the rule under the ICF side of it that the staff member can get first aid CPR certified if they're working with another person, but that's only over there. We see a lot of times, well, they're working with someone else that's first aid CPR certified. The provider cert rule is that it's before direct contact. So unless you fall into another category of services, everyone would need to have it before direct contact, even if they're working with another staff person. Med admin, and as needed, right? So not every staff person has to have med admin, but it would be if they have their high school diploma and if they're working with individuals that need that. The adult day array, different trainings, as well as any licensed home specific training, which is a lot around fire safety drills. Those are some of the additional training requirements. So, and then I have the annual. We're running out of time, so I kind of want to scoot along here and see if you guys have any questions. I'm going to go ahead and change my slide here. All right, so we've got just some other tips in here about annual training plans and maintaining compliance. Part of the revision to the CERT rule was that we have annual training plans in place at the beginning of each year for all levels of staffing. So DSPs, supervisors, DOOs, that we have an idea of what is the anticipated training for this coming year. And then Ann already said this, and we'll just kind of reiterate it, that, making sure you have a system in place to monitor staff expiration dates. What does that look like for your agency? Is something that we help with as well from 19 services, if that's something that you guys would need help with. But checking in to see what your system is in place, because a lot of times that's the next thing that happens, right? We onboarded our staff, we did all these great things, and then we forgot that somebody's first aid CPR expired last month, right? So making sure that we have something in place to keep up with those items. I'll just put in a few words here about the DSP assistant role. This is actually taken directly off of an attestation, which is taken from the rule around what the DSP assistant role can be and can't be. So again, your DSP assistant needs to be at least 16 years or between 16 and 17. It's 16 and 17-year-olds. That they work under the supervision of a qualified DSP. They follow the agency's policies, ISPs, they complete required orientation and training. And then here's all the items that they may not perform. So employees will only work when staff over the age of 18 are present. They will not administer medications to an individual. So that's a really important piece there. If your 16 or 17-year-old happen to have graduated, in all technicality, they can't pass medications until they turn 18. They cannot drive an individual. They cannot perform intimate care to an individual, such as dressing, bathing, showering. They won't perform any tasks for the individual expressly forbidden by the individual, all right? And employees may not implement any restrictive measures. So again, we want to have this in here. You'll have this as something to kind of reflect back on if having, we have seen some situations where DSP assistants are very helpful especially day services, or maybe where you have multiple staff around and you need an extra set of hands where they can maybe be there with other DSPs. All right, so just real quick, we've put in here top HR citations, which really is just a lot of the stuff we've already really hit on as highlights. So those prior to hire checks, making sure wrap-back enrollment is within 14 days of receiving the BCI. We highly, highly recommend that when you get the BCI back, that you stamp it or date it as the day that you received it, because that BCI report, the date on it might be from a while ago. And the only way, you can keep your envelope as well that has it, but we always recommend you date the BCI itself when it was received at the office. Initial training, we kind of talked through all those different components. Making sure that the DOO completes their annual training. Other items, so training plans and other annual training completion. That's again kind of another thing we'll see where we've got our onboarding going, but then the annual training pieces get missed. Making sure that the first aid and CPR is in place, and ensuring skills checks. In-person skills checks are required. That did become an allowance over COVID, but we do have to have skills checks in place. MedAdmin certification, DOO, making sure your PNM information is up to date. So what you have in the provider portal, the address, the phone number, your locations, that tends to be a hiccup sometimes and can cause a citation. All right, I'm going to go ahead. You guys will get these slides. These are all a lot of the same things we've chatted about. And we've got our link in here to Facebook. I'm going to stop talking and see if there's any other questions. All right, I'm going to stop sharing my screen here. Just say thank you again. Oh, sorry, Ann.
Sorry, I didn't realize I had muted. I just was saying there's no other questions in chat.
It's not. I love you, honey. Bye. Be careful.
Okay. Thank you all again for joining us. We want to be mindful of your time. Again, we appreciate it. We've got, thank you all for putting your chats in there. We've got our email addresses when our information goes out. If you, I know Ann put her email address in there. If you've got, questions in the meantime, feel free to reach out. We really appreciate you all. I hope you have a great day.